Cirrhosis is simply scarring of the liver where the liver is no longer able to heal itself. So we would say that scarring is now sort of end stage or stage 4 scarring, but that can still be either compensated or decompensated. And what that really just means, it refers to is whether the patient has symptoms that are not well controlled.
But over time, many patients or most will develop symptoms, and those symptoms are what sort of define decompensated cirrhosis. So that means people have fluid retention in the abdomen that we refer to as ascites. It might occur in their lower extremities. They may have dilated vessels that develop in the esophagus that can lead to bleeding complications. Other people can develop confusion because the liver is not clearing out certain products from the blood effectively. Jaundice may be part of that as well. Once people develop decompensated cirrhosis, then we're really trying to think about whether liver transplantation is an option, because that is really the only cure for people that have that condition by and large.
So for a patient especially with decompensated liver disease, come in to be seen at Mayo Clinic for your liver disease earlier rather than later is definitely the best way to go. The benefit of coming early is, number one, we can check for all of these serious things like varices, which are swollen veins in the lining of the esophagus. We can treat those, prevent them from bleeding so that you may not suffer that life-threatening complication. Make sure that we're watching for tumors that can develop in the liver, really optimize the care of the liver disease and be ready for when transplant is needed.
Having a game plan and having a management plan and a multidisciplinary approach that includes not only transplant surgeons, but the medical side, which is the side that I'm on, the transplant hepatology team, dietitians, nurse coordinators. All of these people are very critical in making sure that a patient with decompensated cirrhosis does as well as they can and ultimately hopefully gets a life-saving liver transplant.